Speaker. Thank you, Mr. Speaker. It's my honor to be here with you this afternoon as we talk about the need to promote accountability, flexibility, choice, and allow small businesses to galvanize together to find the best options for their employees in the changing health insurance market. I want to start today by ceding some time to our friend from the state of Montana, Representative Downing, who has great experience in working with these marketplaces in his home state of Montana. You're recognized.
Well, Mr. Speaker, thank you, and to my colleague from Florida, Mr. Haridopolos, thank you so much. I rise today to discuss or to comment on what I see as the biggest fraud this body has ever put upon the American people. Let's go back to the beginning of the Unaffordable Care Act, Obamacare. How was this sold to the American people? You can keep your doctor if you like it. You can keep your plan. Your insurance premiums are going to go down. And I'll tell you, all of that, this is one time that both the Republicans and Democrats agree it did not deliver on that. The Affordable Care Act, Obamacare, has been one of the biggest drivers in increasing not just the cost of health insurance, but the cost of health care. And to continue this deception, it was clear that this plan would not work. You don't have to be a PhD in mathematics to understand why. As you start to add things, the essential health benefits that you added onto these policies, these required benefits, as you started to add things that had to be covered, and I'm not saying whether those were good or bad, but you add expenses, you can't make prices go down. It'd be like saying if you went to a fast food restaurant and ordered a soda and the price is going to go down, but they have to give you a free cheeseburger as well. It just doesn't make common sense, doesn't make mathematical sense. And so to further this deception, they realized that it only worked by subsidizing it. So you had to levy a tax to subsidize it. And the architects, on the other side of the aisle who put this together realized that the American people would rebel against this if they were given a tax to pay for it. So how did they hide that? Well, let's just tax the payers. Let's tax the insurance companies, and then they can pass those expenses down to the American people through higher premiums. And that's exactly what happened. And so then let's look at another phenomenon. As these prices start going up, people start to question whether they're getting value for what they're paying for. And for some folks, the answer was no. They didn't want to pay those higher rates. And so some folks came off. And as we see, the people who come off tend to be the people who least need services. So the healthy, younger people tend to be the ones that come off. And as they do that, that concentrates the risk. That makes the prices go higher for the insurance companies, for the payers. And so as that happens and you get into the next policy year, they have to raise the rates again. And as they raise the rates again, you lose more subscribers to those policies. And so you further concentrate the risk. And this is known as adverse selection. And so what happens in adverse selection, every time you see that raise, those prices rise, you start to see more people come off. They look for alternatives like healthcare sharing ministries, they look for something else, or they go uninsured. And you start this endless cycle of these prices going up. One other thing I just want to point out, this is kind of economics 101. The more money you put into a system, the more expensive things get. And we've seen that in so many different areas. We've seen that in subprime lending. We've seen that in student loans. We've seen that in so many. You put money into a system, and it starts to push prices up. And one of the other contributors we have is not just adverse selection that is concentrating the risk and making it more expensive for the insurance companies, but we put so much money into the system that we're seeing rises in actual health care. And it's important to make the distinction between the rising costs of health care and the related rising costs in health insurance. And so we've just come to this, death spiral of this becoming more and more and more unaffordable. And in my personal opinion, this entire system is going to collapse under its own weight, and you've got, two solutions. The other side thinks that we should just write a blank check from the federal government, no matter how big that check is going to be, so that we can hide the fact that this is failing. I mean, let's face it, this is this is seen as a landmark piece of legislation that the Democrats have pushed over the last couple of decades. It's important to them to protect this landmark legislation. And I'm sorry, the emperor's not wearing clothes, and in order to hide that, they're doing these smoke screens with these increased subsidies. So now let's look at the subsidies that have really gotten a lot of attention, these Obamacare subsidies that we've been talking about that the Democrats brought in response to COVID. So these are subsidies to folks that are on the individual market. Now, it's important to note that the individual market is a small percentage of the insureds. This is not the entire market. This is not small group. This is not large group. This is a small percentage of folks that are on the individual marketplace that get their health insurance through healthcare.gov or through one of the exchanges. So it's a very small part. And when the Democrats first put this, it was in reaction to the chaos during COVID, and it was by their intent and by their architecture, it was a temporary solution for a temporary problem. So it was designed to expire. It had a sunset. And then when it was coming up to a sunset, when the Democrats still had control and had the ability to make this permanent, they still put an expiration date on it. So these enhanced premium tax credits, or these Obamacare credits, were designed to expire at the end of this year. So essentially January 1st is when they were designed to expire. And that was entirely policy brought by the Democrats. This was not a Republican policy. So this smokescreen that there are estimates between $300 and $400 billion to pay for it over the next 10 years, if they are expanded, like I said, are a smokescreen. And as folks start talking about whether prices are going to go up or go down or what these subsidies do, let's talk about that for a second. Because these subsidies are a very small part of the increases that we're seeing in premiums because of what I've already talked about, because of rising costs of health care, and because of rising costs of health insurance that are due to those health care increases as well as that adverse selection. And so this small percentage, let me just put it in perspective. In Montana, we've got a number of payers, a number of insurance companies, but the one with the largest increase on the individual market was about 25%. It's a high number, I agree. But that 25%, it was a single-digit amount. It was about 9% of that was attributed to the enhanced premium tax credits, to the Obamacare credits. So even without that, the price is going up. And independent of these Obamacare credits that we're discussing, it's going up in the small group, the large group. It's going up in every other part of insurance. So that part without the enhanced premium, so I said that delta between 25 and 9, so let's say that's 16%. Everybody else is still seeing that. They're still seeing that increase. One of the smallest increases we saw from our major payers, was about 10, a little bit over 10%. And it was about 3 or 4% of that was attributed to the Obamacare premiums. And the reason I'm bringing this up is it's a very small percentage of this overall costs. And one thing that I want to point out is if these tax credits are allowed to expire on the 31st, premiums are going up. If we extend them, premiums are going up. It's happening either way. And just one thing I want to end on, just so that people understand, how this process works, is if this body decides to extend those premiums, let's say it's for 2 years or 3 years, arbitrary amount, what happens? The way that insurance rates are filed is they go to the states, the payers, the insurance companies bring them to the state, they file, they're approved, they get filed with CMS, with the Centers for Medicare and Medicaid Services, and then the open enrollment period starts, which is usually mid-November to mid-December. And during that open enrollment period is when you buy your policies for the following year. So we just closed that open enrollment period a couple of weeks ago for the 2026 policy years. Those rates are already baked in. So if we were to extend those credits, the rates are already baked in unless we go to extraordinary measures of allowing the payers to once again refile their rates and then having another open enrollment period, which I would guess would be, March or April by the time you got all that through. And so then what do you do with that? Make those rates ex post facto, have them go back to the beginning of the year, or do you allow it to go through its normal cycle, in which case those rates affect the 2027 year? So the point that I'm making is by extending those Obamacare subsidies, you're not affecting the 2026 rates without going to extraordinary measures to unroll everything that's already happened. And so what will happen is those insurance companies that filed higher rates with the assumption of those premium tax credits staying in will get the benefit of having a higher rate plus having that tax credit. Going back to how I started this fraud was put onto the American people to hide the taxes so that the American people weren't taxed directly. They taxed the insurance companies that are getting these tax credits to change those rates for the people. This is not going to affect what's happening right now without extraordinary measures. What we need to do in closing, and I thank you to my colleague from Florida for allowing me to speak here, what we need to do is we need to start looking at alternatives on what are the core drivers of the cost of health insurance. How do we rate insurance so that younger, healthier people are still willing to pay for it? So we have spread risk there. What are the things that we can look at for driving costs down to stopping this endless cycle of adverse selection so that people can actually, as was promised on this big fraud perpetrated on the American people, have the doctor they want, the plan they want, and have their rates going down. And this Obamacare premium debacle is not the answer, but we do need to get to work and figure out how we can get to the root causes of these rising prices. Because, as I said, this is either going to collapse under its own weight, or we're going to be forced to write an unlimited check from the federal government, which me and many of my colleagues are unwilling to do. And with that, Mr. Speaker and Mr. Haridopolos, I yield. Thank you.
Thank you very much. We appreciate your expertise and understanding of these issues as we take it on towards the future. I want to read one comment before I call up the congressman from Colorado. This is from the Washington Post, maybe the most liberal major newspaper in America. Their comments were simply, many honest people will feel this squeeze next year, but any serious effort to extend Obamacare subsidies would need to include lower income caps, require some out-of-pocket premiums, and impose additional anti-fraud protections. Washington Post says it. They recognize the reality that this has been a broken system that has been covered up for years at the expense of other taxpayers and the overall cost of health care, and that's why we're having this discussion today. I'd like to allocate some time now to the congressman from Colorado, Congressman Crank. Thank you for joining this conversation today. We look forward to your comments.
Well, thank you, Mr. Speaker, and I thank the gentleman from Florida for yielding this time to me. And we heard so much from the gentleman from Montana who knows a lot about health insurance. You know, health care is more than these enhanced premium tax credits. The Democrats have tried to make it about enhanced premium tax credits, but health care is more than that. As the gentleman from Montana pointed out, enhanced premium tax credits, these credits would cover 7% of the American people. 7%. That's what we're talking about with their solution, would be 7%. And even if we were to fix that 7%, what would the fix mean? Well, let's talk about who these people are. These are folks in the enhanced premium tax credit who make, for a family of four, over $128,000 a year. That's what we're talking about. We're not talking about people who are making $40,000 or $30,000 or $50,000. Those tax credits continue under this broken, failed Affordable Care Act system. Those continue. What what my friends over here want to do is pull money out of our pockets and give it to people who are making, for a family of four, over $128,000 a year. That's their solution for 7% of the people. That doesn't make sense. That's what it would do. And what effect would it have? It would reduce premiums by 5%. 5% for 7% of the population, all making over $128,000 for a family of four. That doesn't sound like much of a solution to me, because it's not a solution. The solution is free market reforms. And the fact of the matter is that the enhanced premium tax credit is a Band-Aid on the gaping wound of Obamacare. It's a Band-Aid on the gaping wound of the Affordable Care Act. You know, the left, they love to mislabel things. We know that they called the spending package that they passed 4 years ago, they called that the Inflation Reduction Act. What did it lead to? 22% inflation. 1 year, 9% inflation in 1 year. We're still dealing with the effects of their misnamed Inflation Reduction Act. Well, they called this the Affordable Care Act, and it's been nothing of the sort. It's anything but the Affordable Care Act. My friends, on the other side of this aisle created this mess. No one over on this side, not one person who is here serving in this body on this side of the aisle voted for our current health care system. Not one. Not one voted for the Affordable Care Act. Those who did, on the other side of the aisle, those who did vote for it, they promised a few things. What did they promise? Lower premiums. Where are the lower premiums? This is the Obamacare system that we're living under right now. They promised lower premiums. We're not getting those. They promised better health care. Are we getting better health care? I don't think most Americans believe that we are. They promised that, oh, if you like your doctor, you can keep your doctor. Sure, if your doctor takes the insurance that they force you into. We're currently living under Obamacare, under the Affordable Care Act. So if you don't like our health care system, newsflash, you don't like Obamacare, you don't like the Affordable Care Act. The fact of the matter is that this law was written behind closed doors in a backroom deal here in this building and down at the Obama White House with and by insurance companies. There you go. With and by insurance companies. That's a fact. The scam is this. The scam is that the money's taken from average Americans and sent as a subsidy not to other Americans, but to big insurance companies. That's the scam. That's the scam. Their profits, these big insurance companies, their profits are at an all-time high. United Healthcare profits are up 1,200% under their plan. I always get lectured all the time that we're the ones that are for, we're the ones for big business. We're the ones that are cutting the deals. But they're the ones that cut the deal with the insurance company, and they put it to the American people when they did. And those same insurance companies, they're denying the claims of the very same taxpayers who pay taxes to subsidize their profits. What a scam. A government-sponsored scam. Under the ACA, the government colluded with insurance companies to insure customers for themselves, for the insurance companies, and to profit from subsidies provided by the government. Government intervention does not work in health care. Medicare and Medicaid, government sets reimbursement rates that underpay doctors and cause access issues. So what are the solutions? Very quickly, and then I'll yield back my time. We're $37 trillion in debt. We've got to fix this system. We can't throw money at the problem. We can't just continue to throw more money. We have to fix a broken system. And how do we fix that? We need long-term solutions for health care. What are the real solutions? There's lots of them. I don't have time to go through every one individually today, but the bottom line is we need to get the government out of dictating health care to the American people. We need to return to a patient-centered, market-driven solution in health care that doesn't pick big insurance companies over the American people. The American people should have a choice about who they see and who they pay for their insurance. That's the solution. It isn't this scam. It isn't this election year gimmick that some are trying to make it out to be. It isn't the solution that fixes a 5% fix for 7% of the population. It's real, honest health care reform for all of the American people. And with that, I yield back.
Thank you, Congressman Crank. I'd like to now allocate some time to the congressman from North Carolina, 13th Congressional District, Congressman Knott.
Thank you, Congressman Haridopolos, for hosting this special order on one of the critical issues that we face as a nation and have faced for the better part of 20 years now. I'm referring, of course, to Obamacare, a deceptively named bill, the Affordable Care Act, which has, of course, been a disaster for Americans all over the country. Before it was passed, Democrats essentially allowed big insurance companies and federal bureaucrats to craft an extremely regulated patchwork of rules and cloudy regulations to enrich themselves at the expense of the American patient and the American physician. They then jammed it through Congress without a single Republican vote, ushering in a new era of high costs, restricted access, and lower quality health care. As is the case far too often, this law is now harming precisely the groups of people that it was designed to assist. At its core, Obamacare is a redistributionist program that empowers a public and private bureaucracy rather than patients and physicians. In various medical fields that are not part of the Obamacare web, the harmful effects of its policy have not been seen since the law's passage. For example, over the past decade, the cost of outpatient services rose between 80 and 100% on average. Prescription drugs are up at times 200%. Meanwhile, as a counterexample, the cost of LASIK surgery, which is not covered under the Obamacare policy or subjected to its onerous regulatory framework, has decreased by 30% over the same time. Free from bureaucratic suppression, more providers have entered the LASIK market, and innovations like bladeless lasers have made operations safer, more efficient, and more available. Another example, cash-paid diagnostic imaging is often 75% cheaper than the Obamacare-approved MRIs. Direct primary care providers offering wholesale labs can be at times 15 times cheaper than doctors who are required to fill out government-mandated paperwork. The examples could continue on and on. Sadly, Obamacare has succeeded in blocking free market innovations from reaching the broader American healthcare system. Rather than reform the broken system that they designed, the Democrats are committed to throwing more money at the problem, literally subsidizing a framework that has elevated costs so much that they are even willing to subsidize households earning $600,000 per year. It's time to reintroduce competition into healthcare by removing handouts to corporate titans. We must cut the layers of red tape that hurt patients and providers, and we must build a common sense system that enables the patient to have choices, which will, of course, bring about more quality care and increased access. In a very basic sense, we should not make health care a DMV-type experience. Congressman Haridopolos, I thank you again for holding this special order. Mr. Speaker, I yield back.
Thank you, Congressman Knott. Now I want to allocate some time from the at-large member from the great state of North Dakota, Congresswoman Fedorchuk.
Thank you, my friend. Really appreciate your leadership on this issue and organizing this special order, inviting all of us freshmen and a few other non-freshmen here to talk about an issue that is so important to our country and to all of our constituents. Mr. Speaker, our healthcare system is broken, and my constituents in North Dakota know it. The law that was supposed to make things better, the Affordable Care Act, has definitely not lived up to its name. If you like your plan, you can keep it, they promised. A typical family will save $2,500 a year, they assured. The ACA will help bring down healthcare costs and even reduce the deficit, they claimed. Well, none of that is true. Here we are, fixing the Obamacare mess Democrats created 15 years ago. Families today are paying higher premiums, facing fewer choices, and watching Washington throw money at a problem that needs to be fixed immediately. And yet somehow, my colleagues on the other side of the aisle continue to paint this as a problem that Republicans created. The reality is, Democrats passed Obamacare without a single Republican vote, not one. And they also set the enhanced premium tax credits to expire this month. Ask them why. They had the votes. They could have extended this. They could have made it permanent, but they didn't. They set the expiration date for this month. This was completely their doing. The COVID-era enhanced premium tax credits expanded eligibility far beyond the ACA's original design, including households earning well into six figures. In North Dakota, that means a family of four earning over $125,000 a year. Making those temporary subsidies permanent would cost taxpayers $350 billion over 10 years. And for all that money, it still won't fix the problem. Since the enhanced subsidies were enacted, premiums have increased 31%. 31%. And these subsidies don't show up in people's wallets. They go straight to the insurance companies with no incentive to lower prices or improve care. Even worse, massive fraud plagues the marketplace. A recent Joint Economic Committee study found roughly 35% of marketplace enrollees are now considered phantom enrollees. These are people who exist on paper but generate zero medical claims. The chart on my right shows a massive growth of these types of claims, all the way up to almost 11 million of those types in existence today. Regardless of whether they have a single claim in a year, insurance companies still get paid anyway, and while working families pay more and more and more for their premiums. Democrats call that affordable. North Dakotans sure don't. That's why Republicans offered a different path last night, one that focuses on patience, affordability, and real competition, not endless subsidies. The Lower Healthcare Premiums for All Americans Act takes practical steps to lower costs and expand options. It creates cost-sharing reductions that will actually stabilize the market. These will reduce marketplace premiums by 11% after the first year of implementation. That's nearly twice as much as the impact of extending the Democrats' credits. Our plan also cracks down on pharmacy benefit managers, the middlemen who drive up drug prices. Our plan requires transparency so employers and workers can finally see where their prescription dollars are going. It also expands association health plans, allowing small businesses and self-employed workers to band together and increase competition. This could lower premiums by as much as 30%. Our plan also protects employer-sponsored insurance and strengthens flexible tax-advantaged options like choice arrangements. These reforms give workers control over their coverage dollars and lets employers offer benefits for the first time. Most important, this is just the beginning. We have many more policy reforms coming. Republicans' vision for healthcare is putting patients, not insurance companies, in control, with greater access, more choices, lower costs, and good quality care. These are common sense reforms. It's past time we move beyond temporary patches and tackle the problem head on and fix what's broken. Thank you, Mr. Speaker, and I yield back.
Thank you so much, Representative Fedorchak, and for adding your voice to this very important debate. Next, I'd like to call up a representative from the 3rd District of Missouri, Dr. Onder, as he allocates time and, more importantly, ideas of how we reform our system. You're recognized.
Thank you. Recent polls show that the top issue on the minds of Americans today is that of affordability. Whether food, education, childcare, energy, or healthcare, rising prices are resulting in more and more Americans feeling less secure about their economic well-being. And indeed, prices have been going up. Under President Biden, inflation hit 9% in June of 2022. Cumulatively, over the Biden presidency, inflation is up 21.3%. Things have improved since President Trump and Republicans have assumed office in January. Energy prices are down by 6.3%, and inflation has moderated. But since, with the exception of energy, we have not had deflation, prices are higher than we'd like them to be. But nowhere is the issue of affordability more acute than in healthcare. We must address America's healthcare affordability crisis. As a physician, I will tell you, though, the first step in solving any medical problem is getting the correct diagnosis. Because if you do not know what the problem is, you will not formulate the right treatment. You may make the patient worse. And that's what's been going on. What is the problem then? Our problem is that big government, anti-free market, anti-competitive, anti-consumer policies have made our healthcare system more and more expensive by the year. This has been a problem for a long time, but it was made much worse after the passage of Obamacare in 2010. How did Obamacare, the Unaffordable Care Act, make health care more expensive? Quite simply by removing what market forces there were in our system and expanding the role of government. The Unaffordable Care Act literally outlawed the private insurance market. Remember Barack Obama saying, if you like your plan, you can keep it. They lied. They outlawed your plan. What were the results? The ostensible rationale for the Unaffordable Care Act was to get more people insured, but we know that in many cases, workers lost their private insurance and have been, if you will, dumped by their employers onto Medicaid. The Foundation for Government Accountability has estimated that if non-Medicaid expansion states all expanded and added able-bodied working-age adults to their Medicaid programs, an additional 3.6 million Americans would lose their private health insurance. Similarly, enhanced COVID-era Obamacare credits, and remember, that's what we're talking about today, the COVID-era Obamacare credits, crowded out employer-based insurance. According to the Paragon Institute and the Congressional Budget Office, extending the COVID credits would reduce employer-based coverage by roughly 4 million people. In addition to crowding out employer plans, the Wall Street Journal's Alyssa Finley recently highlighted that the ACA and its subsidies even led many Democrat-run cities, including Chicago and Detroit, to offload public sector retiree health care costs onto Obamacare. These cities moved their retirees onto ACA exchanges, eliminating their unfunded health care liability. Finley correctly argues that COVID credits make this dumping of public sector retirees' health care obligations onto the exchanges even more likely, as few governments have set aside, especially in blue states and cities, have set aside the money to pay their retirees' future health care costs. So through Obamacare, you are paying for the financial irresponsibility of some of our biggest city governments, blue cities especially. And the Unaffordable Care Act has resulted in skyrocketing health insurance premiums. In 2014, the first year that subsidized ACA marketplaces were in effect, premiums increased 47%. That's right, 47% in 1 year. And over the next decade, premiums increased another 96%. The only reason that this is not more obvious to Americans today is that the healthcare consumer is not only paying the premiums, but the taxpayer is paying extensive subsidies, accounting for 90.3% of the increased premium. So healthcare affordability is critical. Therefore, we need to look at the issue that has received a lot of attention these days, the expiration of the COVID-era Biden Obamacare credits, enhanced Obamacare credits. The expiration date passed by congressional Democrats was part of the misnamed Inflation Reduction Act, passed without a single Republican vote. As mentioned, this scheme, known as Obamacare exchanges, resulted in skyrocketing insurance costs. At the same time, we need to address some false assertions about what expiration of these enhanced super subsidies would mean. First, the vast majority of Obamacare subsidies are not expiring at all. What's at issue are these temporary COVID-era subsidies. And even if these enhanced COVID super subsidies were to expire, the federal government and the taxpayers would still be covering 78% of premiums, compared to roughly 88% right now. That is a relatively small change, nowhere near doubling. And in fact, if the COVID subsidies were allowed to expire, only 4.3% of the projected premium increase would be attributable to that change. Again, less than 5% of the increase. And here's the key point the other side does not want to talk about. Obamacare premiums are going up regardless, even if the COVID credits are extended. Obamacare premiums are expected to rise about 18% in 2026, driven by higher medical costs, labor shortages, economic uncertainty, inflation, and other conditions. But these increases are structural. They have nothing to do with the expiring subsidies. What Democrats are doing is conflating premiums with out-of-pocket costs. Premiums are not doubling, and out-of-pocket costs are rising only because of the expiration, and out-of-pocket costs are rising only because the expiration of these enhanced subsidies is exposing a deeper truth that the Unaffordable Care Act is, for many families, anything but affordable. According to CMS, the projected average premium after tax credits for the lowest plan should the COVID subsidies expire is $50 per month. That's about $20 less than they were in 2020. In the year 2026, most enrollees on healthcare.gov will have access to plans priced at or below $50 per month. To put that in perspective, compared to the years prior to the COVID pandemic, marketplace enrollees this year will have access to, on average, lower plan premiums and more choices. But this debate isn't just about premiums. It's also about expanded eligibility and widespread abuse. The COVID expansion dramatically broadened eligibility far beyond the middle class and lower middle class families and significantly increased the subsidies. Under this system, households earning $500,000 a year or more can qualify for subsidies. In 2024, nearly 42% of the enrollees, on the other hand, paid nothing at all. But these subsidies don't go to individuals, they go directly to insurance companies. That's why many Americans see these enhanced COVID subsidies for what they really are: welfare checks to large health insurance corporations. Worse still, the system incentivizes fraud. People are encouraged to misreport their income in order to qualify for larger subsidies and $0 plans. As a result, insurance companies collected an estimated $35 billion in taxpayer subsidies for phantom enrollees. An estimated 6.4 million individuals were improperly enrolled in Obamacare in 2025, often fraudulently taken off their private insurance plans to do so. costing taxpayers $27 billion. Among households claiming incomes between 100 and 150% of the federal poverty level, roughly 62% were not actually eligible. And it gets worse. In 2024, insurance companies received at least $35 billion in subsidies for about 12 million marketplace enrollees who made not a single medical claim, not a single checkup, not a single prescription. About 40% of these people fully subsidized under the COVID credits never used their coverage at all, often because they didn't know that they were enrolled or they didn't even exist. One Social Security number, according to the Government Accountability Office, was used to purchase health insurance 125 times. That is massive fraud. So when fraud estimates from the exchange subsidies alone range in the tens of billions of dollars, it is not unreasonable, no, it is responsible to ask people to contribute something. Even a small insurance payment per month, say $10 or $20, promotes personal responsibility, discourages fraud, and helps ensure that the system serves the people who really need it, not those gaming it, and not the corporations cashing the checks. That is what this debate is about. Facts, accountability, sustainability, making coverage more affordable for all Americans, not the fear-mongering of my Democrat colleagues. Thank you. I yield back.
Thank you, Congressman Onder. I want to allocate some time now to the Congressman from the 14th District of North Carolina, the former Speaker of the House of North Carolina, and my fellow colleague on the Financial Services Committee. Congressman Moore, welcome.
Thank you, Mr. Haridopolos. Thank you, Mr. Speaker. Mr. Speaker, before giving my remarks about the Affordable Care Act, I do want to mention a couple of things. Mr. Speaker, it is with a heavy heart that I mentioned on the House floor the tragic passing of Greg Biffle, his wife and 2 children in an airplane crash that happened just a few hours ago in North Carolina. Just wanted to, on behalf of this body and all North Carolinians, express our condolences to this wonderful family on this terrible tragedy, and just knowing that this family will be in our thoughts and prayers of so many around the nation. Also, Mr. Speaker, wanted to let this body know about the passing of a great leader in our state, former Governor Jim Hunt, who passed away today. The news came out a little bit ago from his daughter, who currently is our state's lieutenant governor. A great man, a great leader in North Carolina, one who loved and cared a lot about public education in our great state, a man who I came to know during my time as Speaker of the State House, and someone who loved his state. So our thoughts and prayers and condolences are with his widow and with his family, particularly as we go into this Christmas season. Mr. Speaker, it is, I appreciate the gentleman from Florida affording some time to not only myself, but to a number of our colleagues today to talk about the legacy of Obamacare that we find ourselves inheriting here in this Congress, a program that passed some 15 years ago before I believe any of the members who have spoken so far today were even serving in this body. But here we are in a situation where we are having to try to clean up this mess. And why would I say it's a mess? Well, I can think back to a time before Obamacare, back before this passed, and health care was less expensive. Health care was more accessible. You could go out and you could afford to buy health insurance. Prescription medications were more affordable. There was, in fact, when I talk to colleagues, when I talk to business owners, when I talk to folks, it was easier to be able to get good health insurance. So Obamacare passes, and what happens? We see health care costs spike. We see prescription drug costs go out of control. We see total inefficiencies in the system. We see a lot of wasted money. We see these phantom insured folks, people who aren't really insured, but insurance companies are receiving billions of dollars every year for coverage that simply does not exist. And look at the premiums. Look at a lot of the sticker shock that a lot of Americans are getting
right now during this time of the year as we're in the Christmas season where they're being told they're going to have to pay more. They need to understand Obamacare is what has caused all of this mess. When you move away from a free market system where you're allowed to have greater efficiency, when you have a system that strives for cost containment, but at the same time, great health outcomes, it works better. Today, you hear stories of denials, delays, everything on insurance, and it costs more. That, my friends, is unfortunately the legacy of Obamacare. And it's why this body is not going to continue to throw good money after bad. It's an investment that is not paying off economically, and it's an investment that is not paying off for the health of Americans around this country. Some of the stats, get this, on the plan premiums, the actual cost, the premium cost, Obama plan premiums have risen 2 times faster than employer plans. Got a chart, probably can't see it on TV, but got a chart, and where you see this thing spiking up right there, out of control, those are the Obamacare resulting premium increases that are happening. This is not acceptable, and it's not appropriate to keep throwing money after it. These surging premiums are also driving a higher federal subsidy cost. So what do we mean? So from the ACA subsidy grew from $18 billion in 2014 to $92 billion in 2023. Now, how many people out there think they've actually gotten better health care in that period of time? I don't think many are going to speak up and say they are. Get this, this year, now I've talked about went from 18 to 92. This year alone, in 2025, costs are projected to reach $138 billion. Again, it just keeps going up. My friends on the other side of the aisle, the only thing they know to do is keep throwing money at it, keep throwing money at it. Nothing to try to improve efficiency, nothing to try to improve coverage, nothing to try to improve the system, nothing but wasting more and more money in a system that is not working. If we were to expand, so the COVID extension, that's what a lot of talk's been about. There was a temporary COVID extension that when Democrats were in charge, they solely passed, right? They passed to put that in place, and the Biden administration put that in with an expiration date. Well, they knew it could not continue. They knew it wouldn't sustain. I think, frankly, they knew it wasn't going to work. But get this, let's say we went along with extending that, it would cost right now $335 billion over 10 years, which is going to, again, only put the budget more out of balance, is going to affect our national debt, and is simply not sustainable. The other thing, and I alluded to this earlier, is what's called the zero claim enrollment. That is where folks really aren't even insured. I think they're called phantom insured. It's not real, but it's money being paid to an insurance company. These zero claim enrollments have more than tripled, rising from 3 to 4 million in 2021 to nearly 12 million in 2024. And get this, in 2024, about 35% of the marketplace enrollees had zero claims, up from 20% before the subsidy expansions. At the same time, these insurers received billions in taxpayer subsidies for enrollees who received no care, including, and this is real numbers, $21 billion in 2023 alone. So to those folks watching, those folks who are genuinely concerned about improving access to health care and affordability, know that the Republicans are serious about this. We passed legislation this week to deal with that, to look at some marketplace reforms, to look at association health plans, to look at PBM reform and transparency, to do things to drive those costs down and to make health care more accessible. Also look at the bill we put in a few weeks ago to put $50 billion into rural health care that will help all of America. It'll help my state, North Carolina, but it'll help all 50 states. Because there are areas of our country that they do not have access to health care because of the rural location, distance to hospital, distance to provider, you name it. Putting those funds in there to make this more available. Don't believe a lot of the hype on the other side out there of just spend money on a system that isn't working. Republicans are serious about improving health care for all Americans. The bills we've passed this week, the statements we've made are clear to that. I appreciate Congressman Haridopolos, my good friend from Florida, for doing this. And I got to say, Congressman, you helping bring attention to this. You did a great job in Florida when you were in the state legislature, the work that you all did to help there. Bringing this issue to the forefront here in Congress. Sir, as a colleague, I appreciate what you're doing, appreciate the time to speak today. And with that, Mr. Speaker, I yield back.
For those generous comments, and we're going to bring up Congressman Nutt, the congressman from the 13th Congressional District in North Carolina, for comments.
Mr. Speaker, I rise today in order to commemorate the extraordinary story and mission of one of my neighbors and her family in North Carolina, someone by the name of Olivia Wooten. Olivia is currently suffering mightily in a battle with ALS. I have watched in admiration as she has remained a constant source of robust encouragement and joy despite her debilitating illness. Her circumstances have only brightened because of the eternal hope that she has in the Lord, her Savior, Jesus Christ. I spoke to Olivia earlier today, who fearlessly and joyfully awaits entry into eternal life, where there shall be no more death, neither sorrow nor crying, nor shall there be any more pain, as stated in Revelation 21:4. She helped me draft these remarks, knowing that they would be heard by all of you today. Olivia Wooten's parents, Robin and Elizabeth, met while attending college in Raleigh, North Carolina. Robin attended NC State and Elizabeth enrolled at St. Mary's. They were married shortly after graduating in 1989 and returned to Robin's hometown in Kinston, North Carolina. Robin and Elizabeth passed the years enjoying all that makes East North Carolina so special. They, with their loved ones, enjoyed hunting, fishing, time at the Crystal Coast, and a community that is more of a family than a neighborhood. In the greatest blessings of all, Robin and Elizabeth became parents to two girls, Olivia in 1992 and Carrington in 1995. In 2016, Robin was tragically diagnosed with ALS. Up to that point, Robin's faith in the Lord had been more ceremonial. While his wife Elizabeth regularly attended neighborhood Bible studies and prayer groups for years, Robin had not. However, that fully changed as Robin came to grips with his diagnosis. Rather than indulging in fear or resentment of assured physical suffering here on earth, Robin encouraged anyone he met to look up and to consider Christ. He pushed others to focus on eternity and to rely on the Lord rather than the fleeting things of this earth. Robin helped others grow in their faith until entering his heavenly home, 1 year after his diagnosis. Tragically, in July of 2023, Robin's daughter, Olivia, would herself be diagnosed with ALS. Since that time, Olivia has surpassed every expectation in how long and how well she has fought this vicious disease. And yes, while she is weakened, she remains buoyant and inexplicably joyful in a manner that can only be called inspirational and miraculous. It was my honor and my privilege to speak with Olivia today. In spite of her physical limitations and her suffering, which are unbelievably real, she will likely not walk unassisted again. She cannot go out with friends today. Absent a miracle, she will no longer be able to travel far from home. Absent a miracle, she will likely never meet her nephew, who will likely be born in the next few weeks. Despite this very real suffering and the limitations that she is currently experiencing, her joy and her hope remain palpable. Olivia knows that her earthly departure is not the end, but rather her new beginning in heaven is with her Savior, Jesus Christ. When I asked her what she wanted me to share with all of you, she simply requested the following for your consideration. She did not bring up policy. She did not bring up new types of ideas for Washington, D.C. She simply said the following: this earth is fallen, and it offers afflictions for which there is no remedy other than in the Almighty. My faith in Jesus has become more vibrant and real than anything I could have ever imagined. To anyone who hears this message, if you do not know Christ, I urge you to consider him. Where this earth offers temporary solutions, it cannot and it will not offer durable and lasting ones. Only Christ can offer real peace, real healing, real rest, and an eternal home. Olivia closed our conversation with a verse which she aptly described as her life verse. It's Romans 8:28, and it simply states, "And we know that for those who love God, all things work together for good, for those who are called according to his purpose." In Olivia's testimony, I can see firsthand, and I have seen firsthand, the truth of this passage. As we enter the week of Christmas, when we celebrate the birth of Christ, I stand in awe and in gratitude for Olivia and her family's witness and example. And I urge each person who hears this to consider her Savior, the Savior of the world, Jesus Christ. Mr. Speaker, I yield back.
Thank you very much, Congressman Knott, and she will not be forgotten. I want to thank Congressman Knott, Congressman Crank, Congressman Downing, Congressman Onder, Fedorchak, and also Congressman Moore for their comments today about the broken Obamacare system. It's simply that. It is broken. It is the reason why they've been subsidizing a broken system for a long time at the expense of so many Americans and so many potential innovations as well. And as this issue's been talked very well today, I want to just remind people of where we were versus where we are. The Democrats had the opportunity to make this a permanent plan. They did not have the votes or the will to get it done. They had the opportunity also to reduce taxes on tips. They had the opportunity to reduce the taxes on overtime, and they had the opportunity to reduce taxes on Social Security, all of which are earned. Those are not welfare programs. Those are programs that are earned, and when they had the power, they chose to do nothing. This year, when we were passing the big bill back in July, we had the opportunity again to reduce costs for this broken system. The Republicans put forth in this body a CSR. And what happened here? They used the Byrd rule in the United States Senate to fight what would have reduced rates by 11%. So let's break away from this discussion about affordability. Let's talk about reality. This is purely politics. Their votes have been shown throughout the year. They care nothing about result. They care everything about politics. And candidly, maybe Republicans aren't as good at politics as the Democrats. But we are pushing policies that work and are based in reality. And that's what this push has been about today. Laying out the facts for the American public to say, this system is untenable, and it only undercuts what could be the best system in the world. And there's been so much discussion about the 22 to 24 million people on Obamacare, which we all found out today, half of which might be phantom enrollees. We found out that the future is not bright when you look at the contrast of what it's doing to the remainder of the people who are paying for their own health care system. There are 165 million people who have employer-based systems that they most likely contribute to or pay out of their own pocket, that they're paying $1,500 to $2,000 a month, and they have to subsidize a broken system on top of it and crowd out a medical system in the process. All we're asking for from the other side is to say, let's start doing some common sense things. And the number one thing I'd like to see us do is simply do income verification, so that those people who pay full freight and subsidize the system know that the people who are being helped are actually people truly in need who qualify for a program instead of giving it away. It's simple identification checks, just like we've asked the Democrats to do on things like voting. Just like we've asked the Democrats to do on simple ideas to make things work again. And when you pay your taxes, which are quite exorbitant, in my opinion, that people know they're actually going to help people. So with that, Mr. Speaker, I appreciate your indulgence this afternoon as we get ready to celebrate the holiday season. And with that, I yield back.
The gentleman yields back.